Good evening all to this weekly huddle. This is our 56th episode of the weekly discussion that we do on the WebEx platform. Most of you know me. My name is Anoop Agrawal. I'm a cardiologist at Care Hospital, and I'm joined by my colleague and co-host for today's session, Dr. Praneeth Polamuri. You all know that the huddle is audience level interaction. It's not a presentation or a speaker model of any sort, where we take a clinical case or a topic and we discuss around that. And I typically pick up a topic, something which is directly relevant to all of us, be it a physician, be it a cardiologist. Even when it is a specialist topic, these are common questions which are asked by our patients. And our motive is to discuss them in a casual format. While we do want to invite science and talk about guidelines, in this huddle, we mostly aim to help a doctor translate what is established science to translate into clinical practice using all the practical and pragmatic things into account. Today, we are discussing about ICD and the questions surrounding ICD, which is implantable cardioverter and defibrillator. This is a patient which we discharged last week, and he has not made a first visit yet as a follow-up. So this huddle will also prepare me to answer his questions tomorrow when he comes for follow-up. So that's kind of my incentive of doing this discussion. So I have already shared the case on the WhatsApp group. I will read it out again for you. This is a 56-year-old male. He didn't have any major comorbidities at the time when he presented. He presented to us about 3 weeks back with chest pain, and at that time, he gave a history of fainting 3 times that particular day at home, where he lost consciousness for a few seconds and then it regained by himself. On arrival to ER, we did the first ECG, which showed anterior wall STEMI, and even before we could react, he went into VT, requiring a short CPR cycle, shock, but enough that we had to intubate him. We quickly moved to do a primary PCI on him, where we found a proximal LED occluded. That was a type 3 LED which was opened. The whole procedure pretty much was done in a VT kind of state. And for the next 72 to 96 hours, so 3 to 4 days were very, I would say, stormy, where he had multiple VT runs where we shocked him probably 40, 50 times. He was on antiarrhythmics. We did cervical stellate blockade, coronary sinus pacing. He was having multiple morphology VT, so we didn't think of anything other than treating him systemically. He improved over the period of time. We put a dual chamber ICD on him on day 10 of illness when he was extubated and doing okay. Incidentally, after putting the ICD, within the next day, he had one shock given by the ICD. We observed him for another 4 days where he had an uneventful stay after that. So on day 15, he was discharged, where he had a dual chamber MRI compatible ICD placed. And at the time of discharge, we reinterrogated his device, and he didn't have any other VT episode since the last shock. And he had very short runs of non-sustained VT, maybe like 6-7 beats. And those were also very infrequent. So we thought he is good now, so he can go home. His ejection fraction on the day of discharge was 35%, which was more or less the same as what he had during his illness when he was intubated and whatnot. So at the time of discharge, he asked a few questions, which at that time I didn't have good answers about. And I thought maybe we'll discuss this because these are relevant questions for our daily practice. So the question that he asked was, he works in a music industry, and he's in a recording room where there are a lot of high fidelity speakers. And he was giving an impression that these are the speakers which are half the wall length height, and there are few of them surrounding him. And at times he wears these high fidelity headphones where he has to listen to for the song recording and everything. And he has recently heard about this iPhone 12, how it interferes with ICD functioning because of the magnet inside. And with all the speaker and headphones and magnets, his question was quite valid. So what he asked is, doctor, whenever I'm ready to go back to work, should I go back to the same place of work? Is it okay for me to go back to the same place of work where there are all these magnets and everything? and that I need to wear these big headphones. And by the way, I use an iPhone 12, which I was using till I was admitted here. So should I stop using it now since I have heard all these things? And he also says that, next to my house, not literally touching, but pretty close to my house, there's this big power station as well. Is that also a concern because that may interfere? Those were his questions. And then there were few questions relevant to that, where at times there are houses which are pretty close to transformers, where we know every community we have got these big transformers. And once a while we have got people whose apartment is literally just a few feet next to a transformer. And then one of our surgeons, he also asked us this question that while we discuss about MRI compatibility and interference or ICD interference, if we could also touch upon how the electrocautery that kind of interferes with this ICD functionality during the surgery, and what are the do's and don'ts that surgeons should look into when they are taking a patient for surgery who already has a ICD. We are talking about defibrillator, not the pacemaker. Although if we have time, we can talk about pacemaker as well. So these were the overall discussion points. I conventionally always start with asking opinion from my co-host, Dr. Praneeth. And then once he shares his thought, then we will go down the list of our attendees. We will take Dr. Hygreaves' opinion as well, but before that, we will hear from some of the colleagues what they would counsel this particular patient, how they would handle. So Praneeth, you take it from here, and then I will go down the list after that.
Good evening, everyone. So definitely interesting questions and relevant questions which he asked. What I understand is currently the devices are a bit sophisticated with increasing technology, and the occurrence of electromagnetic interference with the current generation ICDs is coming in incidence and less likely. So all the day-to-day activity and the daily use electromagnetic devices should not interfere with the way ICD works. But when we talk about these high magnetic field or strength devices, I don't know how much will be the magnetic field that will be offered by his workspace when there are these high fidelity speakers, but maybe they will be higher than what we daily use, but I still think they should not be strong enough to interfere with his ICD. So he probably may be okay going to his workspace, and if he can distance himself from the speakers where he can space himself from those devices, maintaining a distance, which I'm sure will be okay for him to work. So I would say okay for him to go back to his workspace with those speakers. Can he use his headphones? Again, probably headphones may not be having that stronger magnet. So the usage of headphones, I don't think should be much of a problem because I believe their magnetic field is not strong enough to interfere with the functionality of ICD. Then iPhone 12, yes, definitely. Even the company gives warning, and equally the FDA also has some statements telling about warning about the both iPhone 12 and the higher version of models where the magnet is strong enough. So I would say to avoid placing using iPhone in his pocket or somewhere where the ICD is there, and try to distance it wherever possible. And if there is a chance, always better to change his phone because there are enough noise or enough warnings now that iPhone 12 might interfere with the functionality of ICD, and this ICD definitely is important for him. So that will be my take on iPhone 12. And lastly, about the power station, again, because of the sophistication in the technology, probably power station may not be much of an interfere with him because it is definitely not abutting, but some distance is there where there may not be interference. So this is my take on this patient alone.
Thank you, Praneeth. And I also used to think that we have MRI compatible devices. For God's sake, they go on a 3 Tesla magnetic field or a 1.5 Tesla, I shouldn't say 3 Tesla, but 1.5 Tesla magnetic field. And still these devices are designed to withstand that. And now we have got a tiny magnet in iPhone, which seem to be, at least based upon few reports, interfering with the device function. So that certainly got my thinking going in terms of, are we thinking in the correct line? Is magnet inside iPhone any different than the magnet that we have on MRI machine, and the same with the same extension? How speakers and headphones and all these come into play. So I questioned my own thought after I started reading through the iPhone 12, because early on I thought, oh, this magnet is so small. We have MRI machines, so how can an iPhone cause interference? You are right that FDA has a statement, Apple itself has a statement. So it is too obvious for us to ignore now. At least we should discuss about it. If not, take it very, very seriously. So I'm just going to ask few of my colleagues what they would do for this particular patient, and then we will take opinion from others. Dr. Srinivas Raju, I hope you got the case right. If this patient comes to you and asks question about ICD, what would be your recommendation for him?
Right. I think Dr. Pranith has already cleared the question about iPhone 12. All the models of iPhone 12, they have a magnet wherein I believe it interferes with the shocks given by the ICD. So it is preferable to avoid using iPhone 12, or if used, probably it should be kept away in pocket, probably in your trousers than in your shirt. And regarding use of headphones, it is said that headphones, which the larger headphones, as long as they are resting on your head, it's fine. But if it is on your shoulders or if it is hanging down onto your chest, still it is known to interfere with the functioning of the pacemaker. And the question what you asked regarding the electrical field, the high tension wires, if they're going somewhere close to the house, it is still preferable to avoid staying very close to an area where there are high tension wires right across the house.
Perfect. Thank you so much, sir. So I'm going to keep asking my other colleagues the questions, and I keep putting my own thoughts so that I justify why this particular topic deserves an hour of discussion. Remember, this patient had VT storm. This patient had got one recurrent VT after a device placement. This patient is at very high risk of recurrence for VT. And even if there is some chance that the device may not work, I can anticipate this guy having another shock in the next few days, or at least frequent shocks. I can say so. So the price to pay for his device to malfunction is going to be very high. This is not a primary prevention ICD where I'm not that worried about it. This is a secondary prevention, and that too of a major event. So that is why I think it will be very important for us to be confident. And secondly, like you mentioned about high tension wires and whatnot, simply saying to stay away from it may not be good enough. What he's asking us is, should he quit his job or take some other job? Should he relocate to a new house? These are very, very important questions and relevant questions for him. And we need to be showing a little bit confidence in terms of helping him make big decisions in his life. If we say you avoid the wires, and if his room is next to it, then we have to talk about him getting a new house or getting a new job. So these are very relevant questions that he wants us to help him get that answer. So I'm just gonna keep going with my colleagues here, and I'm trying to get the seriousness of this question with respect to the patient. So Dr. Chandramukhi, I hope you got the case that we are discussing. This patient comes to you and asks your opinion about his device. What would be your advice to him?
Good evening all. Thank you, Dr. Anoop. I totally agree with Dr. Praneeth and Dr. Srinivas that when he is maintaining distance from the high fidelity speakers, then he will be safe. But as Srinivas has pointed out, the speaker should be restricted to the head and the ears, and they should not hang over the shoulders or over the chest. But if there is any chance that he cannot keep distance from the speakers, he cannot maintain adequate distance from the speakers, then it will be a danger for him, and they should be avoided, and he should think of changing the job. And regarding the house, like high tension wires and these things, I don't think that they will be very near at such a distance that they will interfere with the function of the ICD. So like it may be safe for him residing in the same house if it is at if it is maintaining an adequate distance from the house or from his room. Thank you, Dr. Anu.
Thank you so much, ma'am. I am going to get some more opinion. Let me see. Let's get a physician perspective. We have Dr. Shankar here. He has been a regular attendee of our huddle. Dr. Shankar, I'm sure while you are not placing the devices, I'm sure patients are coming to you and asking your opinion about what they should do with the device or whatnot. How do you counsel your patients regarding these events?
Good evening to all. Thank you. I thank Dr. Anoop Agrawal and Praneeth. Welcome to icons and giants in the field of electrophysiology, Dr. Agrawal and others. The problem we come across very frequently, because after getting the implantable device, the patients they come and ask us. We are in the periphery. Even in the discharge notes also, only one or two things will be mentioned. Only avoid cell phone and don't take MRI. That's all. Only these two instructions will be given in the discharge case sheet. And friends, his relatives, and many patients, they come with a battery of questions regarding when they are having a pacemaker or ICD. So definitely we face a lot. Even 5 years back, my father also had a pacemaker. So he still today also he asks me many things regarding the pacemaker. He is 94 years old. So regarding cellular phone, these digital cellular phones, what I got the opinion of the experts that it can be kept in the pocket, not near the pacemaker site, but in the other breast pocket, it can be kept, and he can listen to the phone on the other side of the ear. So, suppose if it is placed on the left side, right side, through the right side ear, he can attend to the phones. Regarding the headphones, see, headphones also I tell the same. You should avoid. So if it is possible, with one ear he can get access to the phone. Then he can have these headphones also, making one left side is off. And regarding the speakers, I don't think there is any interference with the speakers, because household appliances, many things don't interfere with ICDs or pacemakers, stereos, television, video recorders, some power tools in the house, electric blankets also. When we go out in a chilly weather, they provide us the electric blankets in the hotels. Even in our residential places also, where we can have the electronic shavers also, they can have, they can use, and micro ovens in the kitchen also. They don't interfere with the cell phones, and even electronic lawn movers also, they don't interfere with the ICDs or pacemakers. These household appliances, regarding this, what I mentioned, they don't interfere with the ICDs or pacemakers. And second thing is, when he is nearer to the power station, definitely it will be hazardous. High voltage power lines and the transformers nearby, definitely they interfere with the ICDs or the pacemakers. So he should be away from that power lines or the transformers. Regarding probably I might have covered all the things. Speakers, there is no problem. Headphones I told, but speakers, there is no interference with the speakers or the TVs or the stereos, anything. He need not change his job as a music lover. So he can continue in the music industry. As far as my knowledge goes, one more thing is we come across, earlier also we discussed this thing, the electronic surveillance devices we come across, metal detectors, anti-theft devices in the supermarkets or in the libraries, they will be there. So better, you should pass through them immediately, and you should not linger near these electronic surveillance devices. This is my, because once we discussed regarding the air travel, when the patient with the ICDs or the pacemakers, when they go for air travel, then they undergo these metal detectors. So there they should inform that I have got this ICD implanted. So that they will avoid, they will bypass or avoid this examination. So regarding these things, because my father, he has still, why I am very much interested today is, even if I get 2-3 points today also, I will convey them to my father. And one more request to the experts, that they should form a pamphlet or some instructions should be there whenever they undergo this ICD implantation or pacemaker. What are the precautions to be taken? Because there is a lot of anxiety and fear will be there amongst these. They will go on asking. Even my father asked, whoever underwent these devices, implantations, what precautions to be taken. So these things definitely carry a lot, and I want the experts to form a standard of a pamphlet with all instructions what to be followed by the patients who underwent these implantations. Thank you. Thank you, one and all.
Sir, thank you so much for covering most of the points that we wanted to discuss. And your suggestion of creating a pamphlet is absolutely spot on. And I'm already thinking of discussing with Dr. Haigreve in the future about how to make an Indian version of a pamphlet which will be very helpful to our patients and which we can digitally circulate amongst us and can be freely distributed to our patients. So definitely, sir, we will work on it, and I hope I'll take some of Dr. Haigrave's time in developing this. I'm going to take one or two opinions, and then we will go to Dr. Haigreve for his understanding on this. Dr. Praveen, if you could unmute yourself and share your thoughts on what you would do with this patient. He's asking you all these questions. Dr. Praveen, if you can hear me, could you please unmute yourself? Yeah, please.
Good evening, sir. Actually, I have no what you call opinion on usage of the iPhone and the interference, sir. But for the other questions, what you call the working in that of the fidelity in high fidelity speakers, I would advise him not to be doing that job, sir, because he had an event even after taking the after the implantation of ICD. So this interference with the device would cause him more morbidity and or mortality. So I would I would advise him to take another job. And regarding the interference of iPhone 12, I have no idea.
Thank you, Dr. Praveen. Dr. Vamsi Krishna, if you can hear me, could you please unmute yourself and share your thoughts about this particular case?
Sir, good evening, sir. Hello,
Yeah,
sir.
hi.
Am I
Yeah,
audible,
hi,
sir?
good evening. Yes, yes, please go ahead.
Sorry, sir. Sir, as Praveen sir was telling, sir, actually, I don't have any idea about iPhone 12, sir. But when it comes to power station, sir, I think if the power station is located nearby to the residence of the patient, then probably it is not advisable, and it is not advisable as it may interfere with the ICD, sir. Then if when it comes to high fidelity speakers, sir, I don't think patient may have problem with the speakers, sir. So I don't think you need to stop working with the speakers. He can resume his work with the speakers, I feel, sir.
Perfect. Thank you so much, Dr. Vamsi. Let us go to Dr. Haigreve. Sir, you heard a lot of us sharing our thoughts on this particular case, because the whole idea is how much does it cost us to make a recommendation? Like, he can easily switch iPhone 12 for something else, but whether he can easily switch his job or switch his house, and are we that determined to say that no, this is too high risk for you and you find a new job or find a new house? The kind of suggestion that we are going to give him, and if you could also give us some suggestion about the surgical aspect of it, which our surgeons asked, what are the tips and tricks and things that we should do when a patient with ICD is going for surgery where electrocautery will be using, and the role of unipolar versus bipolar cautery. So Dr. Haigreve, you can take the floor for the next few minutes and tell us your thoughts on this.
A great, simple but important topic you have chosen, Anoop. I mean, many of us actually forget to include this topic in any of the meetings. Very nice, actually. I'm actually impressed with all the ideas that are given out. Now, at the very onset, two important points I want to make. First of all, these questions which you have raised, they're actually not all or none. See, most of the patients and I can see the doctors also trying to want us to answer them when they have questions. They say, should I change my house? Yes or no. Should I use high headphones? Yes or no. But unfortunately, or actually I should say fortunately only, these things are relative. Everything about electromagnetic interference and CIED, that is cardiac implantable devices, is relative. There is nothing absolute. That is a very good point. The second point is one of the reasons probably, so many of us with so much high volume of devices are not really writing all these things, as you said. It looks like a fallacy on our part. But then one of the reasons, as you're talking, I was thinking, is the incidents real concerns. And third thing is, many of them are not practical. Like, for example, if you write a big list, like I've been listening to a lot of lists.
Haigreve sir, can I interrupt for a second? Haigreve sir, can I interrupt you for a second? Your voice is breaking in between.
Oh, is it?
Is it possible for you? Yeah, is it possible for you to log out and log back in? We heard you so far. It is just that one or two words in between are missing.
Okay.
Will it be possible for you to log in again? In the meantime, we will wait for you to get back on this.
Sure. I will log out.
Sure. Thank you so much. Let us see if in the meantime we can continue our discussion. Let me see. So let me ask Dr. Ravinder Reddy, sir, I hope you are able to hear me. You wanted us to talk about electrocautery and device. What exactly are surgeons concerned about? If you could tell us that, I will ask Dr. Haigreve exactly the same question.
Yeah, because it's, thank you, Anoop. Thanks a lot. We do get probably not very often, but perhaps 1 or 2 a month to operate on patients who have a permanent pacemaker. And we are all mindful of the fact that any electricity we use on patients can cause distortion in any device which is implanted, either permanently or temporarily. And always we get the cardiologist. But then, even though the guidelines say that we need to, keep the quadriplate as far away from the chest as possible, and as much as possible use bipolar. And even if we are using bipolar or monopolar cautery, we need to use them in short bursts. But at times, especially when we are cutting through very inflammatory fat, bipolar won't help, and we need to use monopolar. And that's the concern. So if worst comes to worst, we use it for a few seconds and then stop, and then we need a few seconds and stop. So I wanted to know what are the things that can go wrong on the table, and what do we need as surgeons for us. Remember, as a surgeon, for me, the ECG is an acronym for HELP, help. So what do we need to? Is it just the hypotension, or is it the dysrhythmias, or what do we need to look for? Thank you.
Ravinder sir, whenever you get a patient who has a device, is it part of the protocol in the surgical operating theater to get a pre and post assessment, or how do you guys function?
Yeah, absolutely. We get the EP team. When Narasimhan and team were there, it was all streamlined. They used to come and they used to change the settings. And then once the patient is shifted to the PICU or SICU, they come back and put it back on that. But my concern was what can go wrong during surgery, even now also it is a part and parcel. To be honest, I do not know who's in charge of EP in our hospital right now, but then the surgical team actually invites one or informs one of them. But what can go wrong during surgery, even if the settings are changed?
Sir, for Banjara, I can assure you, you don't have to worry about who is in charge. Just call me or Praneeth for anything. We'll get it done. You don't have to worry about which super specialty something is there. If something is related to heart,
Yeah, I'm not worried. I know I can always fall back on you, Praneeth, and the others. But my question is not getting access. Somebody will come generally at times, even though sometimes they may be a bit late because cardiologists are very, very busy. I appreciate that fact. But my doubt was during surgery, what can go wrong, even if the settings are changed? And what do I, as surgeon, or my team as surgical team, we need to keep our eyes and ears open for?
Perfect, perfect. So Dr. Haigreve is back with us. Dr. Haigreve, please continue, and then you got part of the question that the surgeon wanted to ask.
Yeah,
so
yeah.
please take it from here.
Sorry
Please
for
take it from
my poor network here. Anyway, I was just summarizing. What I was trying to say was that the questions that you all posed are not all or none questions. They are all relative. And one of the good things about the present day devices is the incidence of problems that you face with electromagnetic interference, are the incidence are very, very low now for various reasons. Now, it cannot be totally eliminated by whatever the devices do. The reason being, most of the EMIs occur in 30 to 300 hertz range. And that's exactly the frequency at which the QRS complex of the ECG is also deflecting. So you can never completely avoid the EMI. Now, coming to the specific things quickly. Now, some of them are okay, but the good thing is, as I said, everything is relative. Now, first thing is simple things, speakers and headphones. Now, none of the things you need to completely avoid or change your profession these days. Now, headphones have got a very, very, very powerful magnet. The speakers and headphones, they're called neodymium magnet, and these magnets are used in all the music industry. The problem is, if you put the headphones on your ears, there is absolutely no problem with whatever ICDs or the pacemakers you use. They don't interfere. But if you leave it on your neck, there is a more chance. there is a bit the chance that they may cause some interference because of the distance. So similarly, every single cell phones, if you keep it about 30 centimeters away, none of them will ever interfere with any of the problems, however powerful the magnets are. So, and the second thing is the most of the problems, they occur during the ringing of the cell phone and the call connecting. So that means that is where we leave our cell phones in the breast pocket just opposite the pacemaker. That should not be done. But surprisingly, the Apple watches, Samsung smart watches, there have been studies, they have actually put these watches on the pacemaker, on the ICD, and yet nothing EMI has happened. Now, the second part which I want to tell is also going to be very encouraging. That is, we are talking about, again, EMI. As I said a minute before, nothing is all or none. And similarly, the interference which also causes is not also 100% or 0%. Many of the interference, let us say the total interference are 3% in the reported incidents. And out of this 3%, you will be surprised, less than 0.5% are really things which would cause life-threatening things. Most of them, what do they cause? They cause change into an asynchronous mode. Again, it just changes from a VDD or a DDD mode to a VOO, DOO mode. Nope, that means it continuously paces. No problem at all. Only thing is you need to reprogram it, but there is no harm to the patient. Similarly, pacemakers and ICDs go into the backup mode. Backup mode means just when a pacemaker is coming to the end of life, how it will behave. Like it will just pace and shut off all functions like mode switches and advanced functions. Again, no harm to the patient. So I think high tension wires and all these things which this patient was having concern, they are not practically dangerous because these people who construct these high tension wires and transformers, they leave a large space around it and fence it. So what is safe for you not to enter is safe for you with the ICDs too. They don't really cause. Only people who are actually going to the poles, electricians who climb the poles, or they go inside the transformers and try to. These are the people who should not be allowed to do so. But otherwise, living around these places, or even just not mentioned, but even the cell phone towers, they are not harmful. So this patient need not do any of these things that he is accustomed with, except for the electrocautery pit. Anoop, I mean, answered a few of the questions.
Sir, just one more thing. So this, is there any lifestyle modification or any concern? Like, let's say if I tell this patient to go to work, we talked about how headphones, he should wear it on the head rather than dangling it in the neck. How about the speakers? Is it something that he should maintain a certain distance, or he can walk around the speakers no problem?
See, the distance that is recommended is so small, minute, that for all practical purposes, nobody actually makes a difference. For example, everything that is magnet is talked about is 30 centimeters or a little more than that. Some of them actually say 100 centimeters, 70 centimeters, different papers. But by and large, the speakers, presence of those speakers in his things are not going to change his, lifestyle or harm him at all.
So, sir, in the practical consideration, when you look at these kind of patients and what typically Indian patients face, what are the real considerations where these patients absolutely should not go into? Is there anything that you say that this is absolute, this you absolutely should not do? And then whatever your thought is about the electrocautery as well, where the surgeon's main question is, pre and post cardiologist is doing. He's not worried about that. What he's worried about is during surgery, when he's using the electrocautery, what can go wrong and what he can do. So those are the two questions, if you could address that.
Yes. First, good thing is very few are absolute actually. Thanks to the the ICD industry and all the work they have done on the filters, extremely efficient filters, that very few things are absolute. Now let us see what. Now, if you talk about a housewife or thing, I would specifically ask them whether they are using grinders, the mixies. Now, MIXI's use is okay, but the way they use it is they are not. Many women have the habit of keeping their hand over the lid when the MIXI is on. Now, that is definitely not advised for people with ICDs or even dependent pacemakers, because the vibrations through these things, they transmit and they are perceived as either a rhythm disturbances, or they can even actually cause pacing impedance in patients with this one. So similarly, these shavers, battery operated shavers, are supposed to be more safer than the electrical operated shavers. And again, they are also, as long as they keep above which is generally more than 30 centimeters, it is fairly okay. But generally, this is one thing I would prefer them not to. And vibrating, and any of these people who work with drilling machines, mechanics and other people who operate electric powered drills, and these are the things which can cause. Apart from these, on absolute scale, it is very rare these days to say that you completely change your lifestyle. To put on record, probably for the last 10 years, I don't remember anybody who asked a major change in their lifestyle. Very rare. I don't recall actually. If that's okay, I'll go with the cautery part.
Yes, sir, please.
Yeah. See, the electric cautery has been a very big concern among all hospitalized patients, especially surgeons, have been very concerned about it. Now, I missed a part where you were discussing, but I presume that all patients who require cautery, they are automatically programmed into the asynchronous mode or a DOO or the VOO mode. Now, the way it is every patient who has a pacemaker first should be checked whether he's dependent or he is not dependent. This is very easy, because if you look at the last pacing interrogation, it will give you the percentage of pacing and percentage of sensing. Now, there are some patients whose percentage of pacing is very little, 5%, 10%, or whatever. And these are the patients whom actually, even if you don't program into anything, they are safe. You can happily do surgery and with very little thing. But by and large, if the percentage of pacing is more than 30% or 40%, then there is a possibility that they may end up in long pauses during the surgery, and it's more of a concern for anesthetist to see a long pause each time the surgeon applies a cautery. Bipolar cauteries are often better than the unipolar cauteries, and as long as you're not operating on the heart, the rest of the areas you are far away, you are unlikely to cause direct permanent damage to any of the pacing problems. Once you program a patient to VOO or DOO mode during surgery, your application of the bipolar cautery, you can be completely assured that there will be no harm that you're likely to cause to the patient, because if you're operating anywhere outside the chest, you are far away from the pacemaker, so direct damage to the pacemaker circuitry or even interference is extremely unlikely.
Sir, can ICDs sense any of these electromagnetic interference as a VT and give inappropriate shock, be it in the surgical field or be it outside with any equipment or whatnot?
Correct. Actually, I was talking about pacemakers. In surgery, I missed talking about ICD. Now, in case of ICD is going for a surgery, it is important, especially that they are using the cautery, it is important to turn the therapies off and tell the anesthetist to put a defib pads, and that he is to treat the patient like any other patient whom he sees with a VT or VF, normally what he would do, anesthetist otherwise. So, in other words, the device is not protecting the patient against the VT-VF during the surgery in such patients, and they have to manually do it. And similarly, what you said is absolutely right. Now, the people, that is exactly why I was saying the absolute no-no is only the drilling machines and these things. So, any of these vibrations are going to be can be perceived as a ventricular fibrillation, and they are a possibility that they can give inappropriate shocks. And this has also been seen during electrophysiological study, ablation, radiofrequency ablation of arrhythmias. Now, even then, when RF energy is delivered in the heart for whatever arrhythmias, these ICDs perceive that, and there have been even reports in which a VF or VT has been triggered by the device. So there too, the therapies are completely put off, and then external shocks are given for these patients.
Sir, how about these? You mentioned about electric razors. How about these electrical toothbrush which vibrate at a very high frequency? Are those vibrations strong enough to trigger VT in these ICDs as well?
Surprisingly, logically, we think that electrical toothbrushes should go on this, but somehow it is interesting that the data doesn't show anything like that. When they classify as safe, moderately safe, and unsafe, the devices which are classified as safe, the toothbrushes come in them. Surprisingly, although intuitively, even I would think that it would do like that. Probably it does not. So these don't come under unsafe thing at all.
Sir, how about this use of laser in the laser prosthetic surgery and whatnot that they're using? Can laser interfere with ICD?
Yes. Shockwave lithotripsy certainly does. So this is one of the, that is why, as now we are coming to in-hospital, now to categorically answer your question, you can see that most of the interferences which occur in pacemakers and ICD are in-hospital things. Very few are outside hospital. That is why we are not so much concerned to tell about patients. It is we doctors need to know more. So extravascular shockwave lithotripsy also can cause interference with the pacemakers, and these have to be again placed on. Fortunately, they don't damage it permanently. They only cause these kind of things. So the patients need to be programmed before and after to see if they have gone into the backup mode or any of these noise reversion, as they call. But otherwise, they are not contraindicated.
Sir, one thing you mentioned about putting an external defibrillator when you turn the therapy off, a common question that is asked is if you put a defibrillator pad next to an ICD device, then A, the current may not get transferred to the heart because now there is a metal device sitting next, and B, can the current damage the device itself?
Absolutely. Very pertinent point. Now, when you defibrillate a person who is already having a pacemaker or ICD, it is very dangerous to put the paddles over within 10 centimeters of them anywhere around, and they may cause damage to the circuitry itself. So the way it is done is to give the highest energy of shock to make sure that, because they are a little away from the device, and the paddles need to be kept on the left side only, but they have to be kept away from the device. That is, they are both effective and safe.
So more than 10 centimeter is what you would recommend? And is there a maximum energy that you suggest, or we can go up to 200 joules for a bipolar?
Because you are not putting directly over the heart, it has to be 200 joules.
It has to be 200 joules. Okay, perfect. All right. Well, sir, those were some of the discussion points. If any of the attendees have any questions, please feel free to put it on. One question, sir, that came is, I think you covered that shockwave lithotripsy that we do in the coronary field when we do a calcium atherectomy. So you said when we are doing shockwave lithotripsy, then it is better to turn off the ICD therapies. Is that the correct interpretation?
Correct.
Okay, perfect. Those were all the questions on the chat box. If anybody has any other questions, please feel free. We'll get to Dr. Somaraju, sir. Sir, you heard all the discussion which has been going around. What you would like to suggest to the patient, or if there is any other point that you would like to add in the discussion?
Anoop, thank you very much for asking me. And also, I'm glad that you brought up this issue, as Agrawal pointed out. We don't take as much interest in explaining all this to the patients and family as we take in time to just implanting a device. And before I go to ask one or two doubts or questions, when you ask somebody to change their say job or a house, you must realize you already put an ICD, and for which they must have spent lots of money. And trying to change a job is not easy, particularly during these COVID times. And keep that in mind, the society we live in and all that. So don't ask him to change a job. That's extremely important, and try to make it happen. he can tell his employers to try to accommodate his requirements in a different way. Coming from one of you will make a difference. And the other thing I just wanted to know is two things. The lightning, and when it's raining and it's lightning, what are the effects of lightning on any of these devices you are talking about? And second is the static electricity. Some people emanate. Suppose a patient with a pacemaker or one of the devices touches somebody who discharges static electricity. Can anyone talk about it? The effect of lightning, effect of static electricity from somebody else.
Haigreve sir, two difficult questions for you. One, effect of thunderstorm or lightning on the device, and second, static electricity. Static electricity is very, very relevant in our today's life. So sir, what is your take on this with regard to ICD and pacemakers? Haigreve sir?
Raju sir has never been known to ask an easy question. So the effect of, see, the easier thing is the static electricity. As I said, the effect of anything for that matter, electricity, the electricity emanating sources, whatever they are, it depends upon the intensity of the stimulus and the filters that we have. Now, static electricity, fortunately, I don't have on my mind in terms of the actual numbers, but it is generally so low intensity that it is unlikely to cause any effect on, to my knowledge, on the ICDs or pacemakers. So that is definitely there. I mean, but thunder, I'm not sure there are any case reports on thunder and CIED, but logically, unless if somebody, the thunder strikes the device or something like that, I don't think it has a problem if it is around. It has never been known to cause any damage to the device as such.
Anoop and Haigreve, static electricity, we don't have enough information yet. It's good that one of you start studying about it, and it will be a very important issue, and it will be interesting, though not important. And secondly, suppose the wife emanates a lot of static electricity or husband emanates, you can understand what happens. So then, then the other issue is lightning. Lightning does interfere with these devices, and there was the first case report in 2019, and I think from European Art Journal or somewhere. But peculiarly, in that case report, they didn't mention whether the patient was carrying a mobile phone, etc. And secondly, lightning is extremely important, not only for people, how we conduct ourselves in lightning, not only with any of the devices, but any one of us who don't have a pacemaker on, keep it in mind. Lightning can kill a person even without a pacemaker when you are bare and open and walking out on the street. And if you have to do it, and if you have no other choice, or when you are walking on the street or directly exposed, or you're traveling even in a car, put off your mobile phones. That's extremely important. And after that, hope for the best.
Perfect. Thank you. Thank you so much, sir. I remember very clearly when I was at Nuclear Fuel Complex for one of the lectures. I was actually attending one of their lecture about static electricity. And the scientist who was giving us the lecture, he demonstrated in real, in front of us, how damaging static electricity could be. And there were certain case examples of how cars and motorcycles caught fire at fuel refueling station because of static electricity. And somebody wrote in the chat box that Crocs footwear have been implicated in static electricity generation. I must tell you from the lecture that I got from the NFC, the point that I took is anything which causes more friction at home, they will generate static electricity, and one of the commonest cause is wearing footwear inside the house as a general. So like I wear a footwear inside the house and I still do, but every time I wear, I feel bad about it because I remember from that lecture where the scientist clearly suggested that wearing footwear is one of the highest risk of generating static electricity at home. So better we walk with barefoot or with the socks or something like that. And those places where you have cushioned or carpeted floors, they probably are slightly better off. So I think static electricity is something which we certainly should look into. How much of it interferes with the ICD? That's a question to be answered. But ICD, but static electricity as a general, there is enough for us to worry about. So thank you so much, Raju sir, for bringing that up. Anybody else has got any questions about today's topic that we should discuss?
Excuse me.
Yes, yes, Shankar sir.
I am Dr. Shankar.
Yes, sir.
Sir, we have not discussed about it, though it is MRI safe and compatible, but are there any precautions to be taken when the patient undergoes MR imaging? Because MRI scans, they are becoming a volume year by year, and 50% of the times these implanted patients may require at one point of the time other this MR imaging, because this has become a common today. So what interference we'll get with this MR imaging to these devices? And second is radiotherapy, because if the patient we give radiotherapy on the neck or on the chest, in the carcinoma of the breast or in the axilla, then what interference will get with this radiotherapy? And in the physiotherapy also room, we give shockwave diathermy and these TENS. Nowadays everybody uses this transcutaneous nerve stimulation. So these devices, is there any problem with these devices? Radiotherapy, MRI scan, and these physiotherapy devices.
Thank you, Shankar sir, for asking these questions. I think for MRI, I can tell my impression. Even in MRI compatible devices, we need to do a pre and post programming to make sure that the initial programming remains. And if there is any fluctuation, that needs to be reset. So that is my understanding of MRI compatible devices, that we don't need to change any programming, but we do need to check the programming before and after. As far as your question on radiotherapy and TENS are concerned, they are absolutely relevant. And again, I'll get back to Dr. Highgrave to get his answers. Dr. Highgrave, if you could share your thoughts.
I know, Anoop, you are time bound and the time is less. I'll be fast. See, TENS is a commonly used method for relief of acute and chronic pain, as we know. The repetition frequency of TENS output is similar to the normal range of heart rates. So it is expected that TENS pulses actually cause pacemaker inhibition. You know, the literature is limited, but there are mixed results. So but bottom line is it can be used safely in most patients with bipolar pacemakers. It's reasonable to take special precautions only in dependent patients and monitor the response during the application. And if it is in patients with unipolar pacemakers, yes, it results in interference. And but only thing is it can be easily reprogrammed. The important point to be remembered is TENS must be avoided in ICD patients, because here it is not just a question of interference or asynchronous. It is actually the device will interpret it as a tachyarrhythmia, leading to inappropriate device discharge. So that should be there. And as a MRI, actually, there is I recommend to Nazaran. There is a article, Shankar. Please look up in the PubMed.
Thank you, sir.
Yeah, there's because it's a big list of things that you should need to do. Institutions for MRI, even those without MRI compatible pacemakers, because as I said, though, very rare that serious problems will occur. Most of the problems are some things which are related to reprogramming, and they'll be set right and backup. That is why there is a big list they have given and how to go about it. That is too difficult to go about right now, but that is there. And radiotherapy certainly will harm if it is over the device and in the area. If you are giving the radiotherapy, certainly it is a detrimental to the pacemaker. That has to be remembered. There have been situations in which people have removed it, done the pacemaker, and done the radiotherapy, and they implanted on the opposite side. It has also been done. These laborious things have been done if radiotherapy has to be given to the breast of the same side.
And Haigreve sir, one question came is electric shock injury, if it does affect the ICD, how do we approach that? Let's say if somebody does give a shock over the ICD, what do we do with that?
See, it is like the injury has occurred. Only thing is you need to look at the programmer and see what are the damage that have been done. So the things that can happen is if there is a damage to the circuitry, then you definitely see a rise in the HV impedance. If your HV impedance, the defibrillation impedance is fine, and then and the sensing of the R wave and all these things are fine, there is absolutely nothing to worry. So in other words, there is no need to do a defibrillation threshold test just because somebody has given a shock over this. But if the HV impedance has risen and the charge time, it can easily be assessed. If the charge time is getting prolonged more than 15-20 seconds, then we are in trouble. Then we may have to think of even replacing the ICD if these two things occur.
So that was my follow-up question. The DFT testing or the defibrillation threshold testing that we used to do, there is no need for it. Then how would you know the charge time has increased? Is there a setting in the machine that can tell us without doing a DFT?
Yes.
Okay.
So when you have a charge time, it will tell you the charge time.
Okay, it will tell the charge time. Okay, perfect. All right. Very good. Anybody has got any other questions before we start winding up the session? And while you gather your thought, maybe we can take maybe one more question. And while you gather your thought, yeah, we have Dr. Shankar and Dr. Praveen. Anybody can go ahead.
Hello, sir. This is Praveen.
Yeah, Praveen.
Sir, I have one doubt. As you said, those patients who are on ICD or the pacemakers to avoid any of the one that causes the drilling. I have a small doubt. What about the patients who undergo neurosurgery where you will be the patient undergoing the burr-hole drilling or the orthopedic surgery, sir?
See, the concept, I think, Anoop, we have covered that in the sense that anything that involves a vibration that can be perceived as a tachyarrhythmia, that can definitely cause an inappropriate therapy. So the standard protocol, the easiest thing for surgeons is in all cases is to turn off the therapies for ICD, irrespective of. So unless you are very sure that this particular surgery is not going to have any kind of vibration things, but by and large, we generally talk to the anesthetist, and definitely you have to tell the anesthetist that you are doing this. But so the neurosurgery also, you need to turn off the therapies and turn into asynchronous mode.
Okay, thank you.
Perfect. Thank you so much. Praneeth, we are running out of time. Your closing comments on today's session. What did we learn from today? And then we'll be done after that.
Yeah, so an interesting discussion. Thank you, Dr. Haigreve, for spending time and giving your valuable inputs. We need to definitely know about the importance of ICD and its life-saving measures that it offers, and at no point should its function should be interfered. And as we know that devices are sophisticated and the chances of interference are less, and as Dr. Haigreve was saying, the recommendations are relative rather than absolute. So discussing with the patient or spending some time and knowing about what are his situations and requirements should be taken into consideration before we give a strong recommendation. And in hospital usage, you are talking again to your team of surgeon, anesthetist, and telling them about how these things work, and use of external defibrillators, switching off ICD, and checking them pre and post procedure, be it an MRI or a surgery, is always advisable and should be brought in the routine practice. That's what I could get from this, Anoop.
Perfect. Thank you so much, Praneeth. And thank you, Dr. Hygrie, for attending. I thank all the attendees for today's session as well. And as you all know, we do this session every Wednesday at 7 p.m. All our sessions are recorded and they will be there on YouTube and podcast. The links are there on the invite that you got. So if you want to go back and listen to some of the previous sessions on your dead time, you can do that. We also have a WhatsApp group where we do offline discussion. Whatever we left from here, we can discuss on the WhatsApp group, which is exclusive only for the weekly huddle discussion. So if you want to join that, there is a link for it in the chat box, and the same link is there in the invite as well. Dr. Hygrie, your closing comments for today's session?
Yeah. First of all, thank you very much for giving me an opportunity to be a part of this great program today. So ICDs and pacemakers are increasing in number, and so the problems also will increase. But the technological advances have been so much that the incidence of problems have been relatively very, very infrequent these days. So there is no absolute reason for anyone to change their occupation. Thankfully, as Dr. BSR has commented very correctly, and most of the things are something which just requires a change in the lifestyle and modifications. The important thing is not only the interference of the EMI with the devices is relative, but also the extent to which the interference occurs is also relative. So the smallest things are only a change to asynchronous pacing or a change to the backup mode. The most dangerous are induction of arrhythmias or complete loss of pacing. These are fortunately rare, and these can be prevented by knowing that which are the patients who are completely dependent and taking special precautions in these patients who are going to be dependent. Thank you once again.
Thank you, Hygrie sir. And what Shankar sir mentioned, can we work on something where we create a pamphlet which is suited for Indian patients, which is relevant for our setting? You think we can work on something like that?
Yeah, certainly that is a very positive thing. Actually, it can be done because the industry pamphlets are mostly come from the West, right, Anoop? So right. They are not totally relevant to us. You're absolutely even the photographs of the people they are not Indians.
Yes, exactly. Yes, exactly. So maybe we can do an Indian version of that where we can use terms which are directly relevant to what our patients face.
Yeah.
And then we can translate into regional languages and then share it. So let me work on a prelim design of it, sir, and I'll share it with you, and hopefully we can come up with a collaborative pamphlet on that.
Fantastic.
Perfect. Thank you all for attending today. I really appreciate your time, and we will see you again next Wednesday with a new topic. If there is anything that you think we should discuss on our future sessions, please message to me or put it on the WhatsApp, and we will try to include those as well. Thank you all. Good night, and I'll see you next Wednesday.